what we're learning from China is that patients who have cancer are at greater risk for both getting COVID and, if they get COVID, for having worse outcomes. So this means increased risk of hospitalization, increased risk of being in the ICU, and increased need for ventilatory support. All of these things together tell us that our cancer patients are really vulnerable during this time of the COVID pandemic. And so we're looking at strategies to mitigate that risk. So this includes things like limiting hospital visits, using things like telehealth or virtual healthcare. We're limiting visitors to the cancer center and visitors when patients are admitted. We are reducing unnecessary need to come to the hospital. And then the other things that are coming into play, really detailed screening over the phone before they come to the cancer center and at the door for any risk factors. And we're also starting to test our patients for COVID. So I think we have to look towards technology, not only now, but moving forwards, because I think it's a way to keep us connected. And if you have patients who don't have technology, a good old phone will work. But I think that's one of the strategies that we need to look, using our technology more, looking at virtual clinics, and just generally staying connected as much as we can. Finally, in this very unusual time, I think mental health is important, not only for our patients and their caregivers, but also for physicians. I think ensuring everyone's well-being during this time is really important, ensuring that we have adequate resources, including personal protective equipment, is really important, and also ensuring that people have places to reach out to if need be, if they're not being able to cope or having difficulty. So I think really across the board, COVID is having impacts on multiple levels. Definitely for our patients with cancer, we worry about them really based on everything we're hearing from around the globe. So we're doing our best to keep them safe and at the same time continue with their treatments that they need to be getting.